everyone, my name is Dr. Muolokwu. I'm an OBGYN at Cypress and Fairfield OBGYN, and today we're going to talk about cesarean delivery.
So what is a cesarean birth?
Well, this is the type of delivery of a baby through an incision made in the mother's abdomen and uterus.
What are the reasons for a cesarean birth?
Sure, there are many reasons why a cesarean may be performed. Failure of labor to progress, contractions may not open the cervix enough for the baby to move into the vagina. Concern for the baby, for instance, if the umbilical cord is pinched or compressed and the fetal monitoring detects an abnormal heart rate. Multiple pregnancy, if a woman has pregnant with twins or more, a cesarean birth may be necessary if the babies are being born too early, if they don't have a good position in the uterus, or if there are other problems. Problems with the placenta can cause a cesarean delivery, a very large baby, breech presentation if the baby is not head down in the pelvis, or maternal infections such as HIV or herpes, as well as maternal conditions such as diabetes or high blood pressure.
Is a cesarean birth necessary if I had a previous cesarean birth?
Well, if a woman had a cesarean birth before, she may be able to give birth vaginally. This decision depends on the type of incision used in the previous delivery, the number of previous cesarean deliveries, whether you have any conditions that make a vaginal delivery risky, and the type of hospital in which you will have your baby, as well as other factors. Talk to your OBGYN about your options.
Can I request a cesarean birth?
Sure, some women may request a cesarean delivery if vaginal delivery is not an option. Or if it is an option, the decision should be weighed carefully and discussed with your doctor. As with any surgery, there are risks and complications to consider. Your hospital stay may be longer than a vaginal birth. Also, the more cesarean deliveries a woman has, the greater her risk for some medical problems and problems with future pregnancy. This may not be a good option for women who want to have more children.
What are the preparation for a cesarean birth?
Well, when you have a cesarean delivery, a nurse will prepare you for the operation. An IV line will be put in a vein in your arm or hand. This allows you to get fluids and medications during the surgery. Your abdomen will be washed and your pubic hair may be clipped or trimmed. You'll be given medication to prevent infection. A catheter is placed in your urethra to drain your bladder. Keeping the bladder empty decreases the chance of the bladder being injured during surgery.
What kind of anesthesia will be used during the procedure?
You will be given general anesthesia or an epidural block, or a spinal block. If general anesthesia is used, you will not be awake during the delivery. An epidural block numbs the lower half of the body. An injection is made into a space in your spine and your lower back. A small tube may be inserted into this space so that more of the drug can be given through your tube later if needed. A spinal block also numbs the lower half of your body. You receive it the same way as an epidural, but the drug is injected directly into the spinal fluid.
How is the procedure performed?
An incision is made through your skin in the wall of your abdomen. The skin incision may be transverse, horizontal, or vertical. The muscles in your abdomen are separated and may not need to be cut. Another incision will be made in the wall of the uterus. This incision is going to be either horizontal or vertical. The baby will be delivered through the incisions, the umbilical cord will be cut, and the placenta will be removed. The uterus will then be closed with stitches that will dissolve in the body. And the skin will be closed as well with either stitches or staples.
What are the complications?
Well, some complications occur in a small number of women and usually are easily treated. Infection, blood loss, blood clots in the legs, pelvic organs, or lungs, injury to the bowel or bladder, or reaction to medications or to the anesthesia that is used.
What should I expect after the procedure?
If you are awake for the surgery, you can probably hold your baby right away. You'll be taken to a recovery room or directly to your room. Your blood pressure, pulse rate, breathing rate, amount of bleeding, and abdomen will be checked regularly. If you are planning on breastfeeding, be sure to let your doctor know. Having a cesarean delivery does not mean you will not be able to breastfeed your baby. You should be able to begin breastfeeding right away. You may need to stay in bed for a while. The first few times you get out of bed, a nurse or other adult should help you. Soon after surgery, the catheter is removed from the bladder. The abdominal incision will be sore for the first few days. Your doctor will prescribe medication after the anesthesia wears off. A heating pad may be helpful. There are many different ways to control pain. Talk with your OBGYN about your options. A hospital stay after cesarean delivery is about 2 to 4 days. The length of your stay depends on the reason for cesarean birth and how long it takes your body to recover. When you go home, you may need help to take special care of yourself and limit your activities.
What should I expect during the recovery?
While you recover, following things may happen. Mild cramping, especially if you're breastfeeding, bleeding or discharge for about 4 to 6 weeks, bleeding with clots and cramps, and pain in the incision. To prevent infection for a few weeks after the cesarean birth, you should not place anything in your vagina. Allow time to heal before doing any strenuous activity. Call your OBGYN if you have any fever, heavy bleeding, or the pain gets worse. This information was designed as an educational aid to patients and sets forth current information and opinions related to women's health. It is not intended as a statement of the standard of care, nor does it comprise all proper treatments or methods of care. It is not a substitute for a treating clinician's independent professional judgment. Please check for updates at ACOG to ensure accuracy.
Thank you, Dr. Muolokwu, for the frequently asked questions series, and for this one it's 006 on cesarean delivery.